So we continue. It said learn more about groups at risk for HIV. Risky behaviors like having anal or vaginal sex without using a condom or taking medicine to prevent or treat HIV and sharing needles and syringe play a big role in HIV transmission. Anal sex is the highest risk sexual behavior. If you don't have HIV, being a receptive partner or bottom for anal sex is the highest risk sexual activities for getting HIV. If you do have HIV, be the injective partner or top for the anal sex is the highest risk sexual activities for transmitting HIV. But there are many tools available today to prevent HIV than ever before. Choosing less risky sexual behavior, taking medicine to prevent and treat HIV, and using condom with lubricants are all highly effective ways to reduce the risk of getting or transmitting HIV. Learn more about these and other strategies to prevent HIV, okay? So, now symptoms of HIV. How can you tell if you have HIV? The symptoms of HIV. The only way to know for sure if you have HIV is to get tested. You can't rely on symptoms to tell whether you have HIV. So, knowing your HIV status gives you powerful information so you can take steps to keep yourself and your partners healthy. If you test positive, you can take medicine to treat HIV. People with HIV who take HIV medicine daily as prescribed can live a long and healthy life and prevent transmission to others without HIV medicine called antiretroviral therapy or HART. The various replicants in the body and damage the immune system. This is why people need to start treatment as soon as possible after testing positive. If you test negative, there are several ways to prevent getting HIV. If you are pregnant, you should be tested for HIV so that you can begin treatment if you are HIV positive. If an HIV positive woman is treated for HIV early in her pregnancy, the risk of transmitting HIV to her baby can be very low. Use the HIV service locator to find an HIV testing site near you. What are the symptoms of HIV? There are several symptoms of HIV. Not everyone will have the same symptom. It depends on the person and what stage of the disease they are in. Below are the 3 stages of HIV and some of the symptoms people may experience. Stage 1, acute HIV infection. Within 2 to 4 weeks after infection with HIV, about 2/3 of people will have a fluid-like illness. This is the body's natural response to HIV infection. Fluid-like symptoms can include fever, chill, rash, night sweat, muscle ache, sore throat, fatigue, swollen lymph nodes, mouth ulcers. These symptoms can last anywhere from a few days to several weeks, but some people do not have any symptoms at all during this early stage of HIV. Don't assume you have HIV just because you have any of these symptoms. They can be similar to those caused by other illness, but if you think you may have been exposed to HIV, get an HIV test. Request an HIV test for recent infection. Most HIV tests detect antibiotic protein your body makes as a reaction to HIV. Not HIV itself, but it can take a few weeks after you are infected or your body to produce them. There are other types of tests that can detect HIV infection sooner. Tell your doctor or clinic if you think you were recently exposed to HIV and ask if their test can detect early infection. Know your status. After you get tested, be sure to learn your test results. If you are HIV positive, see a doctor as soon as possible so you can start treatment with HIV medicine. And Be aware, when you are in the early stage of infection, you are at very high risk of transmitting HIV to others. It is important to take steps to reduce your risk of transmission. If you are HIV negative, there are prevention options like pre-exposure prophylaxis that can help you stay negative. Stage 2, clinical licensing. In this stage, the virus still multiply, but at very low level. People in this stage may not feel sick or have any symptom. This stage is also called chronic HIV infection. Without HIV treatment, people can stay in this stage for 10 or 15 years, but some